what we know about diabetics, type 2 diabetics, is that they have a much higher prevalence of testosterone deficiency. And whether it's the chicken or the egg, what came first, the point is insulin would be diametrically opposed to growth hormone. And the higher the insulin, the lower the testosterone. So understanding metabolic health and understanding insulin resistance would be the same thing as understanding hormone or sex hormone resistance.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Dizer. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab, your backstage pass to the future of personalized healthcare. I'm your host, Dr. David Dizer, and today on the show we have Dr. Nick Jensen, a Vancouver-based naturopathic doctor and graduate of the Boucher Institute of Naturopathic Medicine. Dr. Jensen's on a mission to optimize health span, helping you live not just longer, but with more energy, vitality, and meaning. Known for integrating cutting-edge technology and some seriously impressive wellness gadgets into his practice, he guides patients through lab testing, self-discovery, and advanced bio-optimization. Get ready to rethink what's possible when you help your patients take their health into their own hands. Enjoy our episode with Dr. Nick Jensen. Welcome back to Personalized. I'm here with Dr. Nick Jensen. Nick, how are you? Nice to see you.
Good, man. We're just down the street. We haven't even actually officially met in person yet. So it's great to see you online.
My kids play baseball at University of British Columbia, like camps, night stuff. And so I drive by your clinic like all the time.
Yeah.
And I'm obsessed with your retail front, your front window, everything that you're offering, this biohacking approach, the tech approach. People who watch the show, they know that like I'm obsessed with the tech that we can use in integrative medicine. So I actually skip all your history. Let's just get right to the fun stuff. What kind of tech do you have? What's written on the window for your clinic? Tell me all about it.
Yeah, man. So I think our story goes back a little bit to how we brought the tech in. We've been inspired for a number of years by different mentors that we got a chance to work with. And probably in 2017, 18, we started to work with a doc down in the States that really opened our eyes to, I guess, the world of detox and optimal living, optimization, and dialed more into longevity. And sort of this whole world sort of exploded in front of me into the realm of gadgets.
Right.
And it's funny because I don't know if I was ever really a gadget guy before. But when it's related to your health, like it's the Oura Ring, it's, the Garmin watch, it's all these different metric and data tools that we can use to optimize our health. And the application of that biotech industry into health and aging really got me excited. So it was through that inspiration that allowed us to dip our toe into hyperbaric oxygen therapy, to neurofeedback and brainwave entrainment. We recently got a new device called the ARC ATP, which I'll talk a little bit about. We've got beamer technology for your microcirculation, different forms of red light, brainwave entrainment, sauna. I mean, we kind of just opened up this Pandora's box of tools that optimize your internal environment, that allow you to feel better, perform better, look better, all the sort of metrics that we want for ourselves when we're implementing a healthy lifestyle. So There's some of that on the window that you probably see when you drive by.
There is. Yeah, that's some of that. It's ringing a bell here. I was actually just introduced. I'm so behind, so forgive me with all of my questions. Hopefully people who are watching are behind like me and they'll, be caught up because of your experience. But I had someone reach out recently. He's like, you need to write me a prescription for Beamer because my friends are all doing so incredibly well. What is this thing? Can I have this? My pain is severe. Can you tell me what the heck Beamer is and how it's used?
For sure. So it's a German technology, and I don't know if it originally was used on like in the equestrian world, but it's a huge part of the equestrian world. They actually put these mats and coats and different fittings onto their horses because the horses, obviously with running and their different engagement, they get sore. They get sore just like any athlete would, and they found that the recovery times and the performance actually was significantly increased when these horses were using it. So I don't know what came first, the human or the horse, but there's the technology that we've come to know is it's basically pulsed electromagnetic fields.
Right.
And there's a lot of PEMF technology that's out there, but I think the secret sauce to this particular company is that they were able to take a $40 million camera and insert it down into the capillary beds of human tissue and saw the effects of chronic inflammation and just how sluggish that blood flow is through, strangled tissues wherever there's chronic inflammation. And it's fascinating to see just the Beamer videos. We've got one on our website actually that shows this camera at work and what happens after that pulsed electromagnetic field gets introduced into the tissue, and you see this massive increase. And I say to patients, it's kind of like the superhighways of the body just get vastly opened up, and you're getting tissue perfusion like you couldn't do on your own. And one of the key takeaways I think that I try to reiterate for people is that 75% of our cardiovascular system is sitting in our capillary beds. It's sitting in the microcirculation. And it turns out the microcirculation is a significant marker for longevity. Mm-hmm. So this power in this technology to massively increase the microcirculation is significant. So the bigger veins and arteries and things that we know or we relate to with our cardiovascular system is just 25%. And so when you open up those superhighways, it's kind of like you're taking that massive pressure load off of the body and able to perfuse tissue like you couldn't. So in here in Canada, it's called a Class 2 medical device.
Okay.
With a register for pain, inflammation, and cardiovascular health, or something along those lines.
Wow.
Yeah.
Very cool. Okay. Well put. Very interesting. Yeah. PEMF is just it's amazing. People do so well. People report back. It's like, oh my gosh, you have no idea. Like, I didn't have to do anything as well. You just kind of hung out for a bit.
Yeah.
It came out feeling good. Those therapies are great when someone actually feels good right after, not like 2 weeks from now.
It's true. And a lot of these tools, part of the energy of our space was we wanted people to be able to definitely experience it here, but there are some things that maybe might mimic or be close enough or at least open their eyes to it that they can start adopting some of these things at home. Okay. And we find that with the sauna as an example. A lot of people end up jumping into the sauna and like, my goodness, I want to use this every day. Yes. And then so often it's like we're introducing biohacking, and then they start to take it from here and they start to adopt these things into their homes, which is so cool. We can start to see these light bulbs turning on in people's minds and the opportunity for healing that they can take control of their own.
Like actually getting the devices, you mean having them in their house?
You bet.
Oh, that's the best. Yeah. I want to have my whole basement like that.
Yeah.
It's just like this crazy place. The Bulletproof guy had that in Victoria, right? He had the whole, he had like a space where he just had all the different, oh gosh.
Yeah, you bet. Well, that's kind of what we did with our home. We, as we sort of upgraded our technology here at a clinic, stuff, the 1.0 versions get a chance to move into our home. So we have got our old red light. We actually got a sauna for our house.
Wow.
So we've got some of the tech at home as well.
Oh, good for you. Good for you. Tell me about this new one. What is this ARC device?
Yeah. So the it's called the ARC ATP. ARC stands for Advanced Rejuvenation something system, but basically what it is, it's you picture a tanning bed, but you're inside of this chamber. You close the lid, much like a tanning bed, but what it's blasting into your body is there's 6 different wavelengths of light. So it goes through green light, which is relatively, I guess, new on the scene in the biohacking world, and we can talk about what that does. But there's green light, red light, and then 3 different types of near infrared light.
Okay.
So the green light apparently has a high affinity in the research for migraine headaches. It works on the cannabinoid system for pain relief, but also works on the endorphin cascade. So as these lights enter the body, it turns out that they stimulate what's called chromophores inside of our body. And so the green light stimulates an oxyheme and heme chromophore, like what carries oxygen in the system. So as you light up these centers of the body, you're getting all these cascade effects with the green light. The red light, as we know, pain reduction, stimulating collagen, circulation. It has its own, obviously, pain relief response to it. And then there's these 3 different types of near infrared. Near infrared can penetrate deeper into the body. Works on a different chromophore altogether, but most of the red lights work on the cytochrome oxidase chromophore, which is in your mitochondria. So there's a lot of amazing research to show that red light and near infrared can be a mitochondrial optimizer. But then there's this like secret frequency, I think it's 910 nanometers wavelength, which is inside the near infrared spectrum. And this works on phase angle. You might have heard of phase angle from a cellular voltage perspective. People who have very low phase angle, these would be people stuck in chronic disease. Cancer has a phase angle of around 4. People who are really healthy, your athletes, your younger people, they would have a much higher phase angle. And this is all about, all is in relation to the structure of the water inside of our cells. So this particular wavelength actually magnifies that phase angle, increases that cellular voltage, so that you just get healthier. The creator of the bed, his whole slogan is "sick person in, healthy person out."
Love it.
The effects, or the feeling when you're in the chamber, the lights are so bright. And it's a really incredible experience. But like with many, I think, biohacking tools, sometimes you feel the effect right away. Sometimes it's a couple hours later. For some people, it would be after a few sessions. Mm-hmm. But then there's 2 more components to this bed, which sort of take it outside of just the realm of red light therapy.
Go on.
And that is, it has something called resonant frequency. And resonant frequency is it's like a flicker rate, how quickly a light turns on and off. And the way that we understand it, or that I understand it, it's like you might have heard like an opera singer singing a certain tone. And at that tonal frequency, you can hit the resonance of shattering glass. Mm-hmm. And so resonant frequency is much like that. It's hitting a tonality which is tissue specific. So now you can target the heart, the brain, the lung, circulatory system, viruses, bacteria, pathogens, different things like that have a particular resonant frequency that then basically collides with the tones that are coming through the bed. And then one final piece of this crazy thing is it has quantum codes. Okay. So the way that we understand that, and there's early research that is not yet published, it shows that there's a 47% increase in stem cell production. So we're waiting for that research to come out to validate this. But what a quantum code would be, it'd be like a blueprint for what it means to make a healthy liver or lung or heart or whatever it is. And then the body entrains towards higher order. And so in sort of that entrainment, this is where they're finding that tissue regeneration is starting to happen. So, I mean, it's kind of like, it feels like something out of a sci-fi movie, but it's a beautiful piece of machinery, and we're loving it so far. We're just about a month and a half in with it.
Incredible.
You're going to have to come try it.
I will have to come try it. I will have to. I'm glad you didn't call it a laser bed, because it sounds like so much more than a laser bed. Holy.
Well, you use lasers, right?
We use cold laser for pain.
Yeah. Amazing technology.
It's amazing. Yeah, we've got a 904 and an 808 and a 650. But we just do pain management, a little bit of post-concussion syndrome, but we don't do mitochondrial optimization with that, because it's just a wand.
Right.
But this is really, really, really cool. So for the viewers, most of our viewership is like integrated practitioners and naturopaths. Tell us about how you might use a device like this. Like, where would you use it? Is it chronic fatigue syndrome, fibromyalgia, or are there other applications?
Yeah, well, I think like many of these technologies, we try to avoid, we're treating this illness.
Sure. Okay.
I mean, I'm not sure exactly where you stand with your practice, but even when patients come in, what we're trying to do is demystify a little bit of the attachment towards a disease diagnosis.
I like that.
There's nothing wrong with it. I would say like a disease diagnosis would be like a goal we're moving towards, or it gives us a little bit of direction and a place to focus. So in the sense that you can come in with pain or with headaches or fibromyalgia, an autoimmune condition, there are particular resonant frequencies that would match particular conditions. But the whole idea is to optimize your external environment, right? Like where you live, like how you're moving your body, what you're deciding to put into your system. And then there's how do you optimize your internal environment? And that's what tools like this, I think, are so important for. And I think this is where the education for people like you and myself and others, they're teaching, you can actually change the functioning of your internal environments by the choices we make, the foods we eat, as we said, but also through technology. And that's what's really exciting, because you move out of this realm of treating and diagnosing illness and into optimizing health at the cellular level. And that's what gets me excited, because then we're sort of changing a narrative around what it means to be healthy, and how do you be a more resilient human being, a more adaptable human being with more vigor, strength, voltage inside your body and your cells. And at that level, you're not really treating disease. You're optimizing for a healthy body.
That's right. That's right. I've said on this show before that that's where I want to be. Like that sounds like a quite an enjoyable day to be supporting people towards a goal like that. It must be quite rewarding.
Well, how is it for you? Because like I find that for a lot of people, I think that most people are stuck in a disease treatment model. And honestly, I would say that very much, even just coming out of naturopathic training, it was kind of like you've got two paths to go on. There's conventional medicine, and then there's naturopathic medicine, or all the iterations of that, Chinese medicine, chiropractic, etc. But I don't see that so much, this black and white sort of state so much anymore, because, to your point of this podcast, precision, like how do you get super precise for that individual that's in front of you? And how do we sort of wash out a lot of the dialogue or the diagnoses out of the system, so that we can actually understand the systems of the body, so we can support that individual that's sitting in front of us in this, specific kind of ways, as opposed to here's a pain medication, or here's your alternative, here's some willow bark, or here's some turmeric or MSM or whatever. We sort of realized at some point in our career that we don't want to do that anymore. We don't want to just be the alternative. We want to optimize for health.
For sure. Absolutely. And to your point about the stigma, or maybe the connection between person and illness, there's also the connection between person and I found this therapy online for this one thing I have. Whereas you're doing more foundational, like we're optimizing cellular health here. This is bigger than what we found online. How do you navigate that? Like I'm sure people come to you asking for very specific therapies for the things they've been diagnosed for. What's your navigation strategy there?
Yeah, I'd be curious to hear yours too. I would say, like, at the end of the day, we're always trying to meet people where they are. There's only so much myth busting or, mindset changing that can happen on that first connection. But, I would say that people often want to be heard. They want to be validated for what they've researched. And I think, honestly, man, I think it's so important that people are doing that research, and that maybe they even have a sense of hope that there's actually something out there for them that they could sink their teeth into and learn more about. So, yeah, I guess it's more like just a little slight nudge steering the boat. That's great that you're looking into that. Have you thought of this? Or, I love that you're looking into that. Here's a way of understanding our cellular physiology. And let's see how that, herbal remedy or treatment fits into this understanding of what it means to be healthy. I think a lot of people, when we don't have a philosophy, or I guess an overarching or high level understanding of what it takes to heal, you're going to be sort of stuck in a reality of like, I've got this illness, and so this is a treatment for this particular disease. And so I understand why people come in with that kind of mindset. So as best we can, we sort of open them up to understanding of inflammation as a process. It's part of the signals of the body that are trying to communicate to us. And how do we get them engaged more with what they're feeling? And then can we start to educate them on the possibility?
Yes.
But what about you? I'm curious to hear how that goes for you.
Well, hold on a second, though. You're commenting on like all the tenets of naturopathic medicine, and then integrating, right? Then you're integrating high-tech solutions to support this holistic approach, and the foundational piece is education. So you're just being a good naturopath in the modern world, I feel. And I really like that. I'm more like, I'm very primitive, right? I'm like VO2 max better than everything. Test VO2 max.
Oh, I love that though. Like that's the fun stuff too, right?
Right. That's my approach. So in our practice, we spend 30% of our day measuring resting metabolic rate and VO2 max, and making both body composition and
I love that
physical physiology change through nutrition and exercise. And then the other 70% is sort of general naturopathic medicine with a holistic approach and basic tools. Is kind of how I do it.
I'm going to come in for some VO2 testing, man. What do you feel like is the biggest way to boost VO2 max? Like, what are your strategies for that?
Well, we find the limitation physically. So we have 10 markers: lung, heart, muscle, recovery, and at what intensity the limitation is occurring. So we find depth of breathing, oxygen consumed per heart rate ratio, oxygen consumed per breath ratio, and then calorie burn at each stage of the test. And so we find out where someone is limited, and we ask them to train there 2/3 of the week. And so it's oxygen consumed per minute. So how fast can you consume it? So if there's an inefficient space, the fastness declines. And it's divided by weight, the denominator's weight. So we go for an optimal body fat percentage, and then number go up is kind of how we look at that. So that's a huge part of my approach.
Oh, I'm gonna have to come in for some testing. I find this stuff so fascinating, and we're like, we kind of talked about this before. This merging of biotechnology and metrics, and how they can be used as a strategy to not only optimize performance, but I mean that's a biomarker for a healthier body. Fundamentally, that's exactly what that is.
Definitely.
Not everybody wants to play in that department of optimization, but my goodness, if you can improve these criteria within your body, you're a healthier person fundamentally.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Absolutely. Yeah. It's a nice place to be. I absolutely love it. I thought I would be in exercise physiology, and I ended up in that, so I'm pretty happy with that.
Well, you landed where you're supposed to then, obviously.
I think so. You do a lot of tracking, and I'm trying to get into this world of what is optimal. I teach this lab course. I study a lot about optimal VO2 max because I'm obsessed. But now I'm having requests and the desire really to enter into the realm of optimal other biomarkers. And so I'd love to learn about your kind of suite go-tos for biomarker assessment in this biohacking in both longevity and health span world. What do you like?
Yeah, honestly, we call it the lifestyle panel. So we look at there's probably about anywhere from 50 to 100 markers that we'll run on people, from basics like CBCs to liver enzymes to cholesterol levels to LPAs, ApoBs to full hormone suite. We were trained, we actually bought a franchise 2010 called True Balance. It was we were trained under an amazing OBGYN from Sherwood Park in Alberta, and we just took a deep dive into hormone optimization, and so that gave us a tremendous amount of foundation, but also respect for the role of hormones. So the way that we typically communicate to people is through this lens of hormone optimization. But there's a lot of obstacles to hormone optimization, and so the more inflamed we are, the more toxic seed oils that we consume, or the more things are getting into our diet, heavy metals, pesticides, other environmental contaminants, have a tremendous effect on creating hormone resistance. And so a lot of people sort of I think understand that hormones are important. They understand that they make me, quote unquote, they make me feel crazy when they're out of balance. But that's always a huge part of the assessment. And then there's lots of fun markers like DNA damage markers, and there's the NutriVal test, which you might do for full suite of micronutrients to gut microbes. We do a lot of stool testing for gut optimization as well. So to start, I would say we typically run blood work. We call it the lifestyle panel, to run through all these biomarkers and find out where people are stuck. Because I think a lot of people, especially when they listen to Joe Rogan podcast or maybe yours, and they're like, oh, I want to dive into, this really specific thing, or methylation. Mm-hmm. It's like, dude, you're backed up in your liver. Your inflammatory markers are high. Your blood sugar's out of whack. Like there's all these low hanging fruit, and you want to get into peptides and longevity medicine. It's like, well, you got to work on the foundation, right? Right.
Okay. So first of all, I love the approach, and that's what I feel like is optimal. Take the foundational piece. I'm actually giving a presentation soon for the Oregon Naturopaths, I think next week, about the therapeutic order and how that might apply to treatment. There's this application to assessment that's completely relevant as well? What are the foundational pieces that we should be looking for? And you named some absolutely relevant ones there that not everyone is in tune with, right? Like ApoB and Lp(a), and for some of our practitioners, you know, they maybe just be focused on cholesterol and
Yeah.
but there's so much more opportunity through conventional labs to get that foundational piece done. Do you have any specific strategies, for example, for people like to take it to another level? Like you could pick a realm, for example, like cardiovascular disease. Let's say you have elevated ApoB or elevated Lp(a) or some other markers that are range. Are you going deeper, like oxidized LDL, and what are some of the other ones?
Yeah, MPO, like the mild peroxidase.
Yeah, that one. I couldn't remember the name. You got it.
Yeah, I would definitely hit those on people, especially when there's a like cardiovascular history,
Right.
when it would be father, mother, or there's stronger signs and symptoms, or the basic treatment guidelines or the basic strategies, the low-hanging fruit isn't quite moved into resolution. We'll often run much deeper cardiac panels. I wouldn't say that that's the majority of the people, but definitely those who are symptomatic, definitely those with a family history. And like even on that level of like say homocysteine to LPA and ApoB, looking at those markers for people that have been told that they need to be on a statin drug, I think this is a fun conversation to have with people because there's so much fear around cholesterol. And to take those people and just go to that next step. Okay, you've got a cholesterol panel done, great. Your doctor told you should be on a statin drug. Okay, we talk a little bit about the relative risk reduction that you get with statins and what lifestyle changes could do and exercise and all those things. But then we take it a step further and go, well, look, listen, your LDL is slightly elevated. You've got very low HDL. That's your biggest risk factor here. Let's increase your HDL. Let's understand why your LDL is jacked up. And then we'll run the LPA and ApoB and homocysteine and look at some of those other factors. And if those are good, it's generally, you probably have some other oxidative markers that we should run. But generally speaking, I think there's a lot of demystifying that happens. I'm sure you do the same with the whole cholesterol panel.
Definitely. Yeah, like literally that is the absolute number one perfect answer that I wanted to hear, because not that I'm like judging what guests are saying, but I had someone I respect recently giving a talk, and there could be some nuance here about not testing and not going for a detailed assessment. I'm just a huge fan of detailed assessment. For some people, I get it. It is scary, but if you're a good communicator, you can support a person through the fear that comes from having a very personalized lab out of range. I think it gives power, right, to the protocol. Now we have a marker that we know we can, first of all, improve upon, and we get to actually do some personalized, something that's individualized.
Yeah.
I like that. It sounds like you're in the same space.
You bet. And I think that if we don't, we're doing a disservice. I mean, how many times in your career have you had to change what you're doing? I mean, we used to, it was out of the gates, everybody gets a probiotic, a fish oil or whatever, like whatever the story was, right? It was just sort of this generic, you should be doing this. And then I think as a practitioner, I know you asked us a few questions to sort of ponder for the podcast. And I think one of the things that I would tell my younger self would be open to being wrong. But once you find out that you're wrong, be willing to change.
Yeah. And when they come back, then the person comes back and say, oh yeah, I've changed what I'm doing. I tell them, I've grown.
Yeah.
Things are different now.
And you have to.
So that's what you would tell your younger self, hey?
You have to. I mean, what would you tell your younger self? I think that's an important one.
Oh my gosh, just to continue growing. So this is the growth path, right? Like, they say, I don't like it when people tell new grads like, oh, now the learning begins, because then they're just so upset. What did I just do?
It's true.
But a better way of putting it is that it's continuous growth. Where our approaches can improve. Like for the first 5 years, I continued with the exact same protocols I was using in my clinical rotations, right? And then after 5 years, it seemed like I had developed sort of different approaches that were more from me and from the research that I had been following and growing because of. So I would tell my younger self, I think, that is okay, and it's okay to be wrong, kind of the same way you put it.
Yeah. Well, I think if we don't, like, it's easy, I think, as a physician to kind of get into a Superman complex.
Completely.
There's a tool for everybody. It looks like this. We're going to hit everybody with it. And when things don't go the way that you expect them to, it's, are you willing to question your approach, or are you willing to listen to your patient a little bit more? Because clearly you didn't.
Exactly. So how do we do that with hormones? Because you probably have more expertise than most people watching in this realm, especially me. So I'd like to learn from you. The cholesterol and the cardiovascular piece, so many of us are studying and kind of thinking about that all the time. But the hormone piece is a lot more nuanced. What is the approach here? It's a very broad question. But if we could apply the same kind of strategy, and we could talk about approach overall, can you give me your kind of foundational and then advanced application of hormones?
Yeah, I mean, there's so many things to say on this, but I would say, like, as a starting point for people when they're coming in, let's say this individual is somewhere between, say, 35 and 60. That's a good place to start looking at hormones. I would say, you could definitely look at it younger than that. And I think that the world that we live in is more complicated, pollution-wise, pesticide-wise, toxin-wise, stress-wise, addiction-wise with our phones and things like that. I think that our physiology is under a different kind of onslaught than it was, 20, 30, 40, 50 years ago. Our lifestyles surely have changed with more sitting down and, communication via technology as opposed to in person and going for walks and things like that. Obviously, we still do that stuff, but so at somewhere in that sort of age range, let's say late 20s to 60s, which would be our typical patient base, we would be running blood work initially to find out where those hormones are at. So on the level of, let's say for men, we want to find out, is someone truly deficient in total testosterone? Are they running low brain hormones, pituitary hormones, luteinizing hormone, FSH, follicle stimulating hormone? We want to know where in the breakdown someone might be experiencing a deficit. But again, this is why we always pair our hormone blood work with all the other inflammatory markers, or the blood sugar regulation, everything else, because we could be suffering on the hormone side of things because we're running a stress protocol, or there's a toxicity burden in our body, and so we've got hormone resistance as a result of that. So a big part of the initial assessment is diagnosing where someone is stuck. Not just that, hey, you're low testosterone, you should get out and get a prescription for it. It's more like, where's the breakdown happening? Even my own journey, I would say that my testosterone is higher now in my mid 40s than it was when I tested my first test in hormones, was roughly about 11 years ago. And also understanding that different times in our lives, we're going to have different expression of our hormones. So 11 years ago, I was new dad. Our second kid was on the way. And what we know from behavioral endocrinologists like Robert Sapolsky, he talks about when you have a male who's a caretaker, you naturally shift the hormone profile to more of a caretaker profile. So more oxytocin, you're pushing on prolactin, and testosterone naturally declines when you're in this sort of role. So it's easy to go look at someone and say, oh, dude, your testosterone's in the toilet. Like, let's just do something about that. Again, we want to get out of that mindset of like, here's a problem, here's the hammer, let's hit that hammer with that nail. And so that's huge. Again, it kind of goes back to what we were talking about before with precision medicine. We want to understand why there's hormone resistance for that individual. So once we uncover that, we come up with a lifestyle plan, nutrition plan, exercise plan. I would love to send people to you for VO2 max, especially for those ones that are wanting to understand their human physiology a little bit more, and especially how it applies to performance and longevity, of course. So, but yeah, that initial assessment really gives us some clear understanding of where that breakdown in hormone physiology is happening.
That's an excellent approach. Yeah, I like that. I feel like right now it's so missing. I mean, people are just going and looking for testosterone replacement therapy and suffering the long-term consequences of either having to stay on or having an incredible challenge coming off. It's not a huge part of my practice, but do you have some experience supporting people who are either on or coming off of testosterone replacement therapy?
Oh, I'd say it's probably the majority of my practice is hormone optimization. So
amazing.
We work with and over the years we've worked with a number of different medical doctors. Obviously here in Canada, naturopathic doctors do not have authority to prescribe testosterone, so it's always done through GPs that we've established some relationships with, or it's sometimes the case that a GP that the patient already has is willing to work with us or through us to support the patient. So, yeah, I mean, so many people in our practice are either on or transitioning on or transitioning off and using breaks.
That's incredible. This will be my first time. You'd be the first person I'd be chatting with who like has a core foundation.
Oh, really?
Yeah, for some reason, just the number of guests I've had, it hasn't been a huge part of their practice. And so I have some questions for you around it because I am not an expert at all. Can we do some of this? Like, so how do we support a person when they're on testosterone replacement therapy? What are the key things that sort of a naturopathic doctor should be thinking of?
The initial support is making sure that we're in physiological optimal ranges. There's been so much abuse with testosterone, and I think a lot of it has sort of garnered a bad rap, so to speak, because it's often thought of as a steroid, and it's just for people who want to juice up in the gym and throw iron around, and it's just about bulking up and getting huge. And really, the stigma around it, it's really frustrating as a physician who works with these people who are using these medications, because I mean, a great example is someone who's got a thyroid disorder. If you have hypothyroid, a common prescription would be to put on levothyroxine or some Synthroid or some form of thyroid support. But yet when it comes to testosterone or progesterone or some of these other hormones, there's a stigma there. How dare you? Like, oh, you're just performance enhancing.
Yeah, go lift weights.
Yeah, exactly. Fix it on your own. Like, you don't need this. And it kind of goes back to what we said before. We live in a way more complicated world now than, like, biochemically than we would have 20, 30, 40 years ago. Sperm rates are dropping. Testosterone rates are dropping. These are fundamental epidemiological studies that are showing men actually not feminizing necessarily, but significant changes to our hormones. So we do live in a very interesting world where I think men are struggling a lot with identity and how are we supposed to show up in the world, and men are suffering. They're more anxious, they're more depressed in general, and these are the types of people that we see often. So going back into the clinical room, part of it is just engaging with these people and say, hey, listen, you're experiencing A, B, C, D, E. I'm not going to say that testosterone is going to fix everything for you, but if you're as low as you are, total testosterone, your free testosterone's low, your luteinizing hormone, maybe the brain chemicals are running low, clearly you're not going to feel your best. And so when we're working with them, it's really about getting into that physiological optimal range, not into the steroid use range, not into the super physiological dosing, because so much changes when we're in that physiological optimal range, and we've cleared the clutter on all those other lifestyle factors, the inflammation, the liver, the cholesterol levels. So we're chipping away at I see them as sort of two things, where we're chipping away at all those lifestyle factors along with putting that hormonal function in that physiological optimal range. And there, you're not outperforming, or you're not using a performance enhancing medication. You're using a medication that's supporting a physiological optimal state so that everything else can come together more effectively. So hopefully that answers your question. I'm not sure if I went on too long of a tangent.
No, that makes total sense. So other than changing the dose, what are the strategies that we might have for supporting someone who has just started to get them into that range? Like, how often should we test? Are there lifestyle choices that can support appropriate levels? And then I guess next, your point is find out the cause. Where in the chain is there an issue? Can you check the boxes on some of the causes for me?
For sure. So when we're doing a full hormone panel, one of the key markers that's not being tested through, say, general practitioners, like it's very often the case where a man will come into the office and I'm speaking just through the lens of men. Obviously, women have hormones too, and they know about their hormones a whole lot more, but you're a man, so we're sort of talking through the lens of men right now, but both apply. So they'll come in, they'll say, hey, listen, my doc, they would only run a total testosterone. So when you're getting a testosterone panel, you want to look at LH, luteinizing hormone, which is the pituitary hormone. You want to look at FSH. You want to know your prostate-specific antigen. Is there inflammation in your prostate gland, especially for men over the age of 45 to 50? And then you want to know your estradiol. So you want to know what level of estrogen is bioaccumulating in the body. You want to know your DHEA. DHEA is your balancing point for cortisol. It's a real insight into your adrenal function. Some men will run progesterone on, although it's less relevant unless men are really struggling with sleep. Progesterone's a precursor to cortisol, so the more we burn through cortisol, the more we deplete progesterone. But then we want to look for total testosterone, free testosterone, and something called sex hormone binding globulin. And 90%, or roughly somewhere around there, 90% of our testosterone is bound to this protein. And so for a lot of men, they actually have very high levels of SHBG. And SHBG can elevate through caloric restriction, protein deficiency, mineral deficiency, too much cortisol, environmental toxins. There can be lots of different reasons for this to elevate. And if that's the case, sometimes we just need to implement lifestyle changes. We have to optimize for protein intake. We have to get them in the gym, exercise a little bit more. We have to help with detox and elimination pathways. And what we see is when we're doing just that basic stuff, we're seeing a drop in the SHBG, which means their free testosterone can go up. And so these are basic things that don't even involve prescriptions, right? They just involve these really important changes in assessments for deficiencies.
Can I stop you there for 1 second? Because I tried to figure out my optimal levels, like what would be from, so I worked with a company, I sent in my samples, they went through the whole thing and they said, okay, the only thing that's not optimal is SHBG.
Yeah.
And they said, well, we have no suggestions. Can't be changed.
Yeah.
But you just went through a whole list really fast. Can you go through it one more time, but really slow, so I can take notes for myself?
For sure.
Okay. What are the things that make SHBG elevated?
Yeah. So, just maybe one step back from that, what is SHBG? Sex hormone binding globulin is manufactured in your liver. So I always think of everything, every tissue change, biochemical changes in our body is always happening through a process of adaptation. There's always a stimulus and response. So that's important to know. The other thing that's important to know, some people, genetically speaking, will be higher manufacturers of SHBG. So there may be an underlying genetic predisposition for this. But typically speaking, mineral levels, magnesium deficiency, boron deficiency, other vitamins and minerals could be a reason for why the liver is not processing or eliminating more of this SHBG. Caloric restriction is a big one. I did this experiment myself. I do a ton of fasting. And to the point where, and I know you're faster too, so that could be actually a reason. Too much protein restriction can actually lead to a rise in SHBG. So that's another piece. Environmental toxins, that's huge. I mean, the amount of xenoestrogens, like exogenous estrogens that we're getting through our environmental exposures, whether it be the plastics, the phthalates, the heavy metals, the pesticides, all these things bioaccumulate in our body. There's been actually a lot of talk around the microplastics that are getting into our system too, which is very disturbing. And so ultimately our liver has to process all this extra information. And a lot of these xenoestrogens really surge up estradiol maybe, but also the problematic forms of estrogen called estrone or 16-hydroxy, and maybe your listeners understand those terms. But the more we get exposure to these estrogens, the higher the compensation or the adaptation for that is to rise up that SHBG. And SHBG is always thought of to be an interference for testosterone, but it runs interference on your thyroid, your estrogen, your progesterone, all the hormones. So when I see that, I see hormone resistance. And so we have to clean the clutter, we have to detox, pull out the metals, the toxins, whatever. And we see a nice gradual drop to it. And then I would say, like, on a prescription side of things, just increasing testosterone in and of itself, so exogenous or endogenous excretion naturally causes SHBG to drop as well.
Naturally causes it to drop. Okay, so that's incredibly helpful. Thank you very much from a selfish standpoint, but I think the listeners will benefit as well. You mentioned something called hormone resistance, a term I've never heard said before. And then now we have this whole list of things that might be potential causes of that. In fact, I'm working with someone right now who's going through this and only feels good on a very specific dose of boron. So you've given me an idea here about maybe the rationale for that. Maybe there's a lowering of SHBG that's occurring because of that. Thank you.
Yeah, one other test we look at in the hormone department too. I mean, and these are just blood labs. Like we'll often run urine tests for hormones. There's other ways to look at hormones, but as just a snapshot at the beginning stage. But the last one I would say that I would look at would be IGF-1 and fasting insulin.
Okay.
IGF-1 being a signal for growth hormone, and then fasting insulin. I mean, what we know about diabetics, type 2 diabetics, is that they have a much higher prevalence of testosterone deficiency. And whether it's the chicken or the egg, what came first, the point is insulin would be diametrically opposed to growth hormone. And the higher the insulin, the lower the testosterone. So understanding metabolic health and understanding, say, insulin resistance would be the same thing as understanding hormone or sex hormone resistance. Yeah.
Makes sense. How do you do your IGF-1? Is it through the conventional lab, or do you have another lab that you're able to run that through?
Yeah, we just run it through Life Labs typically. Yeah.
Incredible.
Unless we've got, people that we're working with or coaching in the US, we might run a different lab company, but
right.
There's a lot more diagnostics obviously that you can get through the States than you can through Canadian labs.
Oh, completely. Well, yeah. I really like your approach to this. It's given me a ton of ideas to support my patients better, so that's really helpful. Can we transition to the female realm and kind of get a similar idea? We don't have a ton of time for it, of course, and I'm sure you could probably do a whole episode on that. Maybe I'll have to have you back.
Well, I think you're gonna have Sonia on.
Ah, that's perfect.
She's the female hormone guru. So
okay, let's do it. Well, then why don't you tell me, for the sake of our listeners, because everyone's got something interesting about them, what is it about you, Dr. Jensen, that most people don't know? Tell us about that.
I saw this question before and I was like, I don't even know what to say, but
what am I going to say here?
Yeah, well, I'll say one thing. I think vulnerabilities are important to share because, I think that the world we live in, we're always trying to say, well, this is the best thing that nobody knows about me. So I'll say I'm deeply afraid of heights. Like I do not like heights whatsoever. I Capilano Bridge, whenever we go there, my kids are like bouncing around and I'm like just terrified. So that's something that maybe most people don't know.
You'll have to try my VR phobia therapy.
Oh, I'd love that. Yeah, that sounds good.
VR phobia, you got to try that. It's awesome.
Did you watch that longevity documentary with?
The Peter Attia one where he had Chris Hemsworth.
Was it Limitless?
Limitless, that's right. No, I didn't see it, but I watched some of the clips. Why were they talking about VR therapy?
So he had a VR headset on, and he was walking along this like little beam in this mess, and yeah. So
that's what we do here. We do it.
I guess I'm assuming it's something like that. Yeah.
Exactly like that. Yeah, exposure therapy. It's really helpful. Not that I'm trying to treat you, sir. But that's awesome. Thank you so much for sharing. Well, I learned a ton, and you had a positive impact on my practice, and I'm sure for so many people listening today. So I'm really grateful for your time. And even if it's not about female hormones, I think that it'd be valuable for us to chat again. So maybe sometime soon you could agree to come back on the show if that would be okay.
You bet, David. I'd love that.
Sounds great. Okay, well, nice chatting with you. We'll talk again soon. Before I let you go, actually, where can people find out more about you? Give us your socials and your website.
Yeah, Instagram, Dr. Nick Jensen. And then, that's probably the easiest place to find me. Spend more time on there, although I don't spend enough. But that would be the easiest place. It's same on Facebook. And then our website is divineelements.ca.
Perfect. Divineelements.ca. Thank you so much, Dr. Jensen. We'll talk again soon, and I hope you have a good rest of the day.
Thanks for having me.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.